Okay, can everybody hear me? All right, welcome. Thank you so much for coming to the WSU launch of our wellness initiative. Okay, I am Jessica Provines, and I serve as the Assistant Vice President for Wellness and Chief Psychologist. I have the pleasure of working with departments within the Student Wellness Center, which is located inside the Steve Clark YMCA. Those departments include student health services, counseling and psychological services, and our newly created health outreach and prevention education services, or HOPE services. My journey at the university started over 25 years ago as a first-generation sophomore transfer student, and that year was a difficult year for me. I had quickly found myself being very isolated, disconnected, and soon became depressed. And I had no idea that there were quality mental health services available to me as a student, or that one day I would end up leading the wellness areas on campus. We just did not talk about mental health in the late 90s. Thankfully, the way we are doing today, and that's part of why you're all here. So just let me tell you, initially today's event was going to be a leadership training to help us all promote a culture of mental wellness in the workplace. However, when I sat down to discuss it with my boss, Dr. Terry Hall, and her boss, Dr. Shirley Lefevre, they quickly challenged me to think bigger and bolder. And that is when the plan for the WSU Wellness Initiative was formed. So I am so grateful for their support, both to me as a person and as well for the well-being of all of our Wichita State community. So now I would like to welcome, let's see, we're going to talk about the importance of wellness from many campus leaders today. We're going to also take some time to tend to our own well-being. You can't come to a wellness event and not do some wellness activities. We'll connect with our colleagues, and we're going to highlight some of the outstanding work being done by Shockers to promote wellness both on campus and in our community. Then we're going to learn how each of us can be a mental health advocate, nurturing a culture of health and well-being in the areas where we all work and we feel supported to continue to grow and thrive. Now, I would like to welcome our host for the event and Executive Vice President and Provost, Dr. Shirley Lefevre. Mm-hmm.
Thank you, Jess. And I really just have to start by saying thank you to each of you who made time in your day and your week to be here with us. Just seeing a room full of people who are committed to this as much as we are, it makes me feel like we are really at a great place here at Wichita State. So thank you so much. I also have to take a little bit of time to just point out, I know that all of you are looking at my iWatch and noticing that those rings are not closed. So I'm a little bit sad that I took this photo at a fairly early in the morning. So also note the time on that watch. Anyway, you have to love your iWatches, right? So again, thank all of you for joining us at the launch of our wellness initiative to promote mental health and wellness and support for our students, faculty, and staff. I want to say a special thank you to our CAPS and our HOPE teams for putting this together, but more importantly for thinking about creating a program like Suspenders for Hope. And Jess may not bring it up, but it's really gone nationwide and could not be happier. And in my opinion, really reflects the entrepreneurial and the can-do spirit that we have at Wichita State. So I think we need to give a hand to Marcy and Jess. And
Or where did we mention?
So our goal is to continue to stress the importance of including mental health support as an integral component of Wichita State's holistic support services. As a compassionate and empathetic community of Shockers, we want to make sure we acknowledge the challenges and obstacles that we all face at various points in our lives and provide the support to overcome those challenges for our entire Shocker community. An important initial first step in launching this wellness initiative is to create a wellness steering committee with the goal of enhancing, promoting, and celebrating wellness activities across the university. So our first strategy is to accomplish these bullets that you see here. And through the steering committee, we will engage campus leadership and key stakeholders, conduct a process of discovery to identify and coordinate campus wellness activities, advocate for community wellness efforts to be implemented, gather student and employee input, and host professional development opportunities to promote and celebrate individuals and programs championing wellness on and off campus. For our students in particular, that is really the core of our Student Success and Persistence Initiative, removing barriers to success. It's something we're all committed to in helping our students in their journey of learning and personal growth so that they may realize their full potential. This wellness program represents another facet of our commitment to their success. The objectives of this initiative include the stated objectives of the WSU Wellness Initiative. To support student and employee retention, specifically SIM Goals 3.9, and to foster a culture of wellness and belonging across the university that contributes to optimal academic performance, enhance, promote, and celebrate existing important work being done to foster community wellness at WSU, and to establish WSU as a leader in the promotion of community wellness both on and off campus. So today's launch marks a significant step forward in our commitment to the holistic well-being of Wichita State University community, and by recognizing mental health support as a vital component of student and employee success and well-being, we affirm our dedication to breaking down barriers and taking proactive measures to creating a healthy campus environment. Once again, thank you for your support and dedication to what we hope is an impactful initiative. Together, we will make a difference for our students, our university, and our community.
Thank you. Again, Shirley, I can't state enough how much your support of, wellness on campus and of these initiatives has meant to me. And thank all of you again for being here. So now I would like to introduce you to our Wellness Executive Steering Committee. As the chair of this newly formed committee, I am looking forward to working with all of these individuals to help advance this initiative. And as I read your names, can you please stand and we'll have you be recognized. So first we have Larry Burks, who is our Director of Military and Veteran Services. Indeed. Linnea Glenn May, Associate Vice President for Academic Affairs. Sarah Mata, our Executive Director of Hispanic Serving Institution. Lainey Mazzullo Hart, Director of Communications. Sarah Stevens Selman, our Hope Services Project Specialist, who's there in the back. Now, Sarah and I have been working on prevention efforts on campus for a number of years together. Some of you may remember the Shocker Safe Ride program, which was an initiative to help reduce drunk driving on campus. And that was a community business that Sarah owned. And then I worked on the Alcohol Advisory Board, and we partnered together to provide that service for students. And so then when we got a campus Garrett Lee Smith suicide prevention grant, I was so excited that she was willing to come and help work on that grant and help continue our prevention work together. So it's been a long time, my friend. Yeah. And then Vicki Wisenhant, sorry, Chief Human Resource Officer. I did it perfectly earlier. Mm-hmm. Okay. One of the things that as a steering committee that we're going to be exploring is looking at adopting the Okanagan Charter as a guide for how we continue to engage in this work. And as you can see, the vision for the Okanagan Charter is that health and well-being promoting post-secondary campuses transform the health and sustainability of our current and future societies, strengthen communities, and contribute to the well-being of people, places, and planet. I think it's important to note that it's not just as a person our well-being, but it's the environments in which we're in. And this building, for example, is a beautiful testament to biophilic design and how our emotional well-being is better when we're in spaces that incorporate nature. So people, place, and planet. Two calls to action of this charter are to embed health into all aspects of campus culture across the administration, operations, and our academic mandates. But not only do we focus on campus, we serve our community. So the second call is to lead health promotion action and collaboration locally and globally. And I can't think of two statements that better define Wichita State than these two statements. We've been engaged in this work for a long time. We have currently endorsed the charter, and our steering committee is going to be bringing a plan forward to the president to explore fully adopting and signing the pledge sometime this year. In order to help with our plan and to identify what activities are currently taking place on campus, as well as what are the gaps that we have and where could we do better, we really need your help. And so I'm asking that each one of you take time to complete this simple 8-question survey to tell us, what are you currently doing to promote wellness in your area? And also encouraging those on your teams and those that you work with to fill out the survey and help us know better what's happening and what we can do. This could be a formal part of your department's mission. For example, your mission might be to educate future healthcare providers on the importance of self-care and planning, mental health days and planning mental health days. Or it could be an informal walking challenge that you might have between colleagues in the office. Remember that the charter relates to people, place, and planet. So those sustainability efforts that your office are doing count as well. Now, I'd like for you just to take a couple of minutes to chat with 3 or 4 of you in a group and just discuss what are some of the things that we're doing or some of the things that we'd like to do to promote wellness in our area. I hope you learned some interesting new ideas from your colleagues, or that you started getting some of those ideas percolated. If you could please take those back and include them in the survey, that would be so helpful of you. So this is actually what the survey looks like. There's going to be 2 questions that not only ask what you're currently doing, but they want to know suggestions on what you think we could do to enhance our wellness culture at WSU. So excited to hear all of your feedback and see how you think we can improve. Okay. Now it's very exciting for me to unveil the new Health Outreach, Prevention, and Education or HOPE Services Department. As a community clinical psychologist by training, I got involved in prevention work on campus as a graduate student, serving on and later chairing what was the Campus Alcohol Advisory Board to address the harms of high-risk drinking at Wichita State. Over time, that board transitioned into the Prevention Services Advisory Board, which focuses on the promotion of health and well-being and the prevention of substance use, suicide, and sexual violence. However, we always knew to be more effective that dedicated staff was needed to address these campus, community, and societal issues with upstream, population-based primary prevention programming before a problem takes place. I am so grateful for my colleague, Dr. Marcy Young, her shared passion and commitment to this and her dedication at seeking grant funding, which has allowed us and the university to support a long-standing but little-known multidisciplinary board on campus, now with a dedicated team of prevention experts. Together, we have big dreams for bringing hope to people in despair across the country, and she is especially gifted at turning dreams into reality. Now, I would like to introduce the new Director of Hope Services, my friend and colleague, Dr. Marcy Young, so we can hear from her more about the second strategy.
Thank you. Thank you, Dr. Provines. See, now my jaw jumped. I don't know how many times I took that picture down. It just kept popping back up. I'm a walker, and I'm going to try not to walk because we're live streaming, so I'm going to try to stay right there. But I just want to take a moment before I start talking about Hope Services and just reiterate the gratitude that Dr. Provines expressed for our leadership, for Dr. Lefevre, for Dr. Hall. Dr. Hall, for the 5 years that I have been here, has been a tireless, unyielding champion. And Dr. Lefevre is so willing to use her considerable gifts and skills to maximize everything we're doing. So thank you both so much. I'm going to make a concerted effort today not to talk and make it sound like an Oscars award speech where I just list thank yous to a lot of people, but there are so many people who've been involved in this. And I'm gonna try to keep all my thank yous to a minimum, but please just know that this is such a not even a small group effort. It's taken hundreds of different people working to move this forward. We have, as Dr. Provines said, for a very long time, known that we wanted to move toward creating a department. Creating a department specifically designed for increasing wellness on campus. And in the fall of 2019, when the Counseling and Testing Center knew that we were splitting, we very strategically and thoughtfully chose the name Counseling and Prevention Services because we wanted to really express that this was the direction we wanted to go. And in all of that, we have been looking for grants, been able to find a lot of one-time funding, and really expand our efforts. For you all to just be aware, what was Prevention Services is now Hope Services. So if there are questions about what happens to all those programs, they're continuing. There's nothing that all of a sudden is going away. We just got a fancy new name. So, and in all of that, I actually want to take a moment specifically to thank Dr. Christopher Leonard, the Director of Counseling and Psychological Services, and Heather Stafford, the Director of Student Health Services. They do a lot of behind-the-scenes support, and they don't get nearly enough credit. So I just wanted to take a moment to say thank you. We wouldn't be where we were today without their choosing to support all of this. We have, as we are moving forward, the goal in Hope Services to help increase a safe environment on campus where every student, faculty, and staff feels connected, feels like they belong, and is really able to believe that not only is their mental health important, but that they have the resources to be able to take care of their mental health, their physical health, their wellness, and to know that the university cares about those things, that we want to support you in caring for yourself and for caring the people around you. As part of this, we have strategy number 2, which is to establish our dedicated department to promote population-based primary prevention, community wellness efforts, unveiling the new Health Outreach, Prevention, and Education Hope Services Department. We will continue to focus on 4 main areas, which is to promote mental and physical health and wellness, the prevention of suicide, substance misuse, and sexual violence on and off campus. Those 4 areas were selected through a lot of review of literature, and also that several national organizations such as NASPA, SAMHSA, lots of acronyms, places, have all identified as the 4 main priorities for universities across the country. So we'll continue to focus on those. And in the past year, we have been able to directly contact over 14,500 individuals. And it is activities like over the over 2,000 people we've trained in our preventing suicide training, or individuals who have attended events or tables. But what that doesn't speak to is all of the behind work that the staff and team that we are do. And those are items like distributing crisis magnets and medication deactivation bags to housing, to create brochures for the Shocker store to give away for when students pick up their free birthday t-shirt. If you're a student and you don't know that's a thing, that's a thing. And with those shirts, they actually now get a brochure talking about how to decrease use around substance use, or decrease risk around substance use. So it's been, we've had 40 applied learning opportunities last year. And all of these, as we're looking at those 4 areas, are vital to the health and the safety of our campus. We want to expand the Wellness Faculty Fellows program. We have a lot of official and unofficial faculty fellows right now. We want to make more of the unofficial faculty fellows official. And in those type of efforts, we've been able to engage in activities such as creating an undergraduate research lab that gets honors college credit, and the creation of sexual violence prevention activities that are currently being tested that mirror our wellness in the classroom cards. That's you, Jody. And of our wellness card sets, we've been able to distribute over 1,200 of those across campus. We would like to develop a multidisciplinary prevention services and community wellness academic program in order to increase certified, qualified prevention specialists in the state of Kansas. We are going to continue to coordinate the Prevention Student Ambassador Program. It's our peer ambassador, our peer education program. Currently has about 20 students, and each one is dedicated to a different population group or area on campus. We would like to continue to assist the Wellness Executive Steering Committee to execute the strategies that they create, and to manage the Suspenders for Hope mental wellness and suicide prevention program. That's both on campus and in the community. You'll hear a lot about that program if you haven't already today, don't you worry. And also to secure a permanent home for Hope Services. Hope Services is currently in a space that we are very grateful for, but is very not permanent. And while it is actually super fun to have an eye wash in your office, comes in handy more times than you'd know. We are always aware that we need to find a permanent space. And in that realm, I actually just want to take a moment and thank all of the staff of Hope Services. When you're grant and one-time funded, it requires a lot of flexibility. And sometimes that flexibility is my entire job is changing because we just got some new money. So they are energetic and tirelessly working to help make this campus a better place. So thank you all. I would like to talk about what was the Prevention Services Advisory Board and is now the Hope Services Advisory Board. We have each subcommittee that mirrors our four areas of focus. So we have preventing sexual violence, preventing substance use, preventing suicide, and promoting wellness. I wanted to put this is what our group looked like at the end of last fiscal year. And it has shifted a little bit since then, as it always does. But I wanted the pictures up here for one reason, or actually for two reasons. One, so you could see all the cool people that were on this advisory board and be like, hey, I want to join that. And two is to thank all of the people on the advisory board. Some of them have been on there for years and some of them for a few months. But we do a lot of really great and meaningful work. And that work is highlighted in so many of the activities we do, but they don't get a lot of recognition or credit, again, because it's behind the scenes. So thank you to every person who is currently or has been on the advisory board. And if you would like to join, let me know. This is not a group that we are trying to be exclusive. We want a lot of voices and we want a lot of views. And we have some lively discussions and come to a lot of good conclusions, I feel. So please, if you are interested in joining, don't hesitate. Please reach out. We recognize that different groups have different values and norms, and in order for the Suspenders for Hope program to resonate with our different audiences, we have been listening to, partnering with, and collaborating with different audiences and different groups in our communities. We have been listening, and we've adapted our materials to various groups like LGBTQ plus community, faith communities, first responders, and those with a history of military service. I would like now to introduce Larry Burks. I'm going to mess up all the names today. That's going to be a thing. Larry Burks, the Director of Military and Veteran Services, now to talk about the importance of serving the mental health needs of those with a history of military service.
Thank you very much. Good afternoon, all. Just like it's been said before by my colleagues, we have a lot of people in our worlds that we want to thank for allowing us to expand our programs and do the things that we've done. So I want to again thank our university leadership for all the support they have given us, particularly for the Military and Veteran Services Center, and specifically to Dr. Marche Fleming Randall, who is my direct report VP. From our center, starting off in a very small classroom setting to the center that I have currently at Grace Wilkie Hall on the first floor, which will eventually move over to the old Clinton Hall to be on the third floor, where we will have that new consolidated student center there. So I'm looking very forward to that, but that would not happen without the support of our university leadership and understanding the importance of the missions that we have. So I want to thank you all again for that. The veteran community has long acknowledged the fact that military service has caused a number of mental health issues for those who have served, one of the most notable being PTSD. Along with improvements with mental health services at VA facilities, our center continues to refer student veterans to this resource and maintains what we call a quiet room within our center, which offers a place of rest, relaxation, and reflection, which helps in the relief of depression, anxiety, and the sense of helplessness which accompanies this condition. Now, our quiet room is just simply that, a room. We have some nice, comfortable furniture in there. We can turn the lights down, close the doors, and you can just be there to kind of do the things I just described. It's a very simple setup, but it's one that's very vital in assisting people that have PTSD for them to be able to make it through the day. Being able to find this space can help regain control and focus during the day. This quiet room is a standard part of what we offer to the student veteran community, and anyone else at Wichita State University who is in need of this solace. And this and so much more we owe to those who have sacrificed all in their service to our country. On a closing note, I want to share with you that Dr. Provines made a presentation to our Vet-to-Vet Coalition of Sedgwick County. It's a group that I'm a part of, has about 75 different other veteran-friendly organizations throughout the city, and shared this vision. It was very well received, and it was acknowledged by all that this is a program that benefits all veterans and all those who support them. So this is going to be an outstanding program, and the veterans of our community and in Wichita State are going to benefit substantially from it being here. Thank you.
Thank you so much. One of the ways that Hope Services is trying to serve the community and to help address healthcare inequities is by partnering with members of the Spanish-speaking community to adopt the Suspenders for Hope mental wellness program into Spanish. Over the past few months, we've been overwhelmed by the support and feedback we've received. We have been able to train and partner with Spanish-speaking facilitators, and we have community groups that have now set up free training scheduled every month this fall in a collaboration with Salud Bienestar, Spanish ad hoc translations, and additional activities and events through a collaboration with Radio Lobo, Ascension Via Christi, and the City of Wichita. Now, I would like to welcome Sarah Mata, Executive Director of Hispanic Serving Initiatives, to share how imperative it is that we create a sense of belonging on campus for our Hispanic students.
Good afternoon. Again, my name is Sarah Mata, and I'm the Executive Director for Hispanic Serving Initiatives. This being a part of this initiative is really important to me. My own personal research is looking at women faculty and their experience with cancer and how the university can help in those situations and also hinder. And so how do we help our institutions to do better to serve individuals who are in very vulnerable situations is something that's near and dear to my heart. But in regards to the work that I'm doing as the Executive Director for Hispanic Serving Initiatives, it's important not only that we help to serve our students while they're on our campus, but also how do we help our students who do want to give back to their communities in more effective ways. And so the work that's being done with the Spanish translation of the Suspenders for Hope has been impactful in so much of our communities. And how do we help to get more students who are part of wanting to go to be and contribute to the services, and especially when we know that Spanish is, those who are bilingual can really have an impact in serving the communities in ways that those who do not have the multi-language skills. And so you can see by the statistics and the information I've posted in this particular area how important and how impactful mental health services and helping with our community can be vital, knowing that suicide is the third leading cause of death within Hispanics and Latinos who are 10 to 24 years old, but also men who are 25 to 34 years old, which is really, some of our student population that we need to be aware of. And so for all the reasons I've just mentioned, there's a stigma that's still very much a part of the community that we need to help to break down. The language barrier is something that can also be a hindrance in why folks do not seek services that might be vital to the support of their community, and also helping our students who do have the heart and want to go back and serve in a counseling role, in a social work role, who are bilingual, to utilize them to be able to contribute and connect them to services here in the community so that we're helping to meet the needs where there is a shortage and encouraging more of our students to want to do this. So thank you.
Thank you so much. We are also working with employers to address their mental health wellness culture as a business strategy and actively taking steps to work with our Human Resources Department at WSU to adapt the program to employees within the university, contributing to a psychologically safe work environment. And now a few words from Vicki Wisenhant, our Chief HR Officer, on steps WSU is taking to support the mental health of our team members.
Thank you, Marcy, and thank you all for being here today. I'm Vicki Wisenhant, and I'm honored to be a part of this initiative. Health and well-being is a cornerstone of human resources, and in addition to that, eliminating the stigma is a personal commitment for me and mission for me, because I've had family members and friends that have suffered with depression and just haven't sought out the help that they needed when they needed it because of the stigma. And so anything we can do to help eliminate that, I'm all in. So glad to see that you're here with me. I'm pleased to share with you today our strategy at Wichita State to coordinate student and employee, which is a big piece of this, right? Because there's been a lot of focus on our students, but we've also got to focus on our employees' mental health programming and make this really a comprehensive campus approach. So very excited on this partnership. So this strategy involves a lot of steps in it and tactics under it. So in addition to reviewing our student and employee policies and procedures, which is a good place to start, is making sure that when we are setting up our policies and procedures that they are addressing and making space for mental health and making sure that people are in a good place. We're also going to be looking at highlighting all the existing resources, identifying gaps, and providing recommendations for additional resources, again, for both students and for employees. Partnering with HR to adapt and adopt the Suspenders for Hope program. This actually started this summer. All of the HR team met and with Marcy came to facilitate, and we started our journey to become health advocates and really be aware of what the signs are. As you can imagine, in HR, we meet people sometimes at their lowest points in the workplace, and it's hard for them to know what resources and things are available. So the better we can be educated to know those signs, the better we can help support and make sure that they're getting the resources they need to find the care that they need. Encouraging all campus leaders to host departmental installation workshops. So that is the workshop that I just was talking about. And we were intentional around the word installation workshop. It's not a training, right? This is not just a check the box, go to a training and you're done. This is about how do we make a shift and become advocates and have this be a part of our DNA here at the university. So there is a participation goal that we've set at 90%. I actually would love to see that at 100% and challenge all the leaders here in the room today and those online to try to take that on, not only for your existing staff, but make this an ongoing commitment. So as you have new people coming in and joining your teams, make sure that they're also attending those workshops. We're also looking at partnering with our academic departments to ensure that the program is part of first-year student experience for all majors and track participation, including graduate programs. So that's really critical. I think as Jessica shared her story, I think probably all of us have a similar type of story, right, as being in college, and it's a very vulnerable time. So it's really important, especially for those first-year students, to catch them early. And then finally, looking at creating or exploring resources needed to bring staff and faculty mental health treatment clinics to campus, maybe within the CAPS department, and expanding on our existing EAP programs. So we're interested to see what potential opportunities there might be there. Creating a mental health strategy inclusive of our faculty and staff is really vital to our overall success of eliminating the stigma on our campus. And as Jason Bosch, who I think is on his honeymoon right now, mentioned to our senior leaders last week, much like the safety instructions that we all have heard when we're on the airplane, take the oxygen for yourself first before helping others. So too, we must attend to our own mental health needs and those of our colleagues so that we can really be there to fully support our students. So with that, I'm going to turn it over to Terry Hall, Dr. Terry Hall, to expand on the efforts on our Suspenders for Hope mission and bringing this to people in times of despair across the country.
Thank you very much.
So my staff know me well enough that when you give me a microphone, I'm always going to go off script. So earlier I saw Dr. Chris Leonard come in. There he is. So what I'm going to go off script and talk about, I'll stand by the camera though, is that he was, he's the original Dr. Suspenders, right? Back, he was known for wearing suspenders, which then became the kind of model for where the suspenders comes from. And I just think that's kind of cute. And then I wanted to make sure that Dr. Leonard gets his due. I don't see him wearing suspenders as much anymore. It could be that I see him running a lot more, so he may not, need the suspenders to keep his pants up as much. But I guess probably Vicki would tell me that's appropriate for me to say from the microphone, but she's gone, so we're all good. So I am Terry Hall, the Vice President of Student Affairs, and I am very proud of the work that CAPS has done, that Jess and Marcy, but, just it's amazing the village that's been created. And I'm also really proud of the fact that I think part of the success that we have is that they're very good at then saying, oh, yeah, and then we have Suspenders for Hope. And they're really good at always helping us keep it to the forefront that this program and this initiative ties into so many different aspects of the student experience and in our own lives. So thank you all very much for that. So I talked about where it comes from. So our goal is, my personal goal is the third button down where it says expand the national campaign. I have a dream that these suspenders become the international symbol for mental wellness, mental well-being, and prevention, suicide prevention in particular, that there isn't that kind of symbol. If we talk about other things, there's a pink ribbon for Susan G. Komen, there's the puzzle piece for autism, there are all these kind of other things. There are plenty of things that have symbols, but for this area, there isn't. And I believe that we have it here. And so I put that out there to all of you to help me buy into this dream and help spread this dream, because it is critical. When Jess was talking about that these are issues that are identified on college campus, for the longest time, university presidents would say alcohol abuse was the biggest issue on the college campus. Presidents really aren't talking about alcohol abuse in the way that they used to. All the presidents and all the data that I'm reading all are talking about the mental health and well-being of our students. And so this is the critical issue that if we're serious about our students and helping them develop resilience and develop healthy lives, this is a space where we need to spend our time. Jess is going to tell me to go back to the script. But thank you, Jess. We're also working with our foundation and alumni engagement to develop some permanent funding sources and some streams. So when I talk about the dream about the suspenders, Jess has dreams too. Jess wants an endowment that then supports this program long-term, right? Not only supports the Hope Kits that we would like to create, but then so that Marcy doesn't have to do garage sales and rummage sales and keep writing grants every other week so that she has money to go buy. So let's see what my thing says. You have the clicker? I think it's you next, Jess. We're not listening to it? Where do I click play? Like here? Thanks, Marcy.
It's what encourages them to get help. There has been a lot of great work done around reducing mental health stigma in our society, and the workplace is the next frontier. The We Support You Suspenders for Hope mental wellness and suicide prevention program is a strategic, comprehensive approach to help organizations enhance their mental wellness culture.
Ascension Via Christi has the largest behavioral health service line in the state of Kansas. And so we see people every single day who have attempted suicide or are expressing thoughts about suicide. For a long time, Ascension Via Christi and Wichita State have had a really solid partnership that has benefited our community. Development of the Suspenders for Hope program was kind of a natural progression of that partnership that we already have to begin to tackle the huge issue of suicide in our community.
We took this idea of suspenders supporting your pants and expanded it to how can we empower communities to support each other in their mental health. After our success at the university, workplaces have actually started coming to us wanting help on how do we address this with our teens. And we feel like we've provided a package that is very easy to implement and something that you don't have to be a professional with a mental health background to do this.
Mental health training should absolutely be a part of every single workplace's training. I am the general manager of a restaurant in Thrive Restaurant Group. I recently took a training course in Austin, Texas on the Suspenders for Hope program, and it's incredible because I actually used the training to help a team member of mine get through a really tough time. I took her in the office and I just said, let me tell you a story. And during my story, you could see her face just lit up. And after I was done, she opened up to me and she told me how she was feeling. And right away, I grabbed the Suspenders for Hope sheet that I got from my conference and I handed it to her. And I said, please reach out. Our company is involved in this and they will take care of you. The program could not be any better. It was right after I got back from the training and I had instantly helped somebody.
When you complete the training, you get a free shirt, and this then becomes a sign to your organization, to your community, that you are an advocate for mental wellness.
Through a grant we received from Kohl's, we were able to offer the Suspenders for Hope training to all of the associates who work for Ascension Via Christi in Wichita. We were able to take the Suspenders for Hope t-shirt that Wichita State uses, customize it for Via Christi, and we allow any associate to wear the t-shirt to work any day. It is really a visible sign of support. We have seen such a positive impact of Suspenders for Hope training with our associates. We have stories about how this training has saved lives.
I didn't originally take the training, but my manager talked to me about his experience with taking the training for Suspenders for Hope, and after that, I decided to take the class as well. I didn't think I'd ever need to use that training, but the few weeks after I took the class, I had a call that a friend was in a crisis and needed help. So I felt comfortable calling 911 and going to her house. So she initially didn't want to go to the hospital, but I was using the terms I learned in that class to help her understand she needed to get help and get to a safe place, which she did agree to do. And we got her the help that she needed. She came to the hospital, she got stabilized, and then got her outpatient treatment as well. I'm really thankful that I did take that class. I never expected to use it, but it was life-saving for my friend. So I'm thankful that Ascension Via Christi sponsored this class and that Wichita State put the class together. Although no one ever wants to use this training, it's so valuable to have in case you're in that situation and you need to take action to help someone.
This program works in any industry, whether that be healthcare, education, manufacturing, the food service industry. It really has applications to help. This can be a difficult topic, and it can be challenging for organizations to try and tackle it. The Suspenders for Hope is designed to help celebrate resiliency and to help us all know that we have a role to play and that we can support each other.
So these are some of the partners we have so far. That's Nebraska Wesleyan up there. We also have Penn State Altoona. And then Just House, we just had Newman join on. And over 6,000 individuals have been trained in this program to date, which is pretty amazing. So here's my challenge to you before I do. Now Jess is like, oh my gosh, Terry, this is my challenge to you. So as a person in recovery, I look for signs of recovery and substance abuse in all aspects of life. My challenge to you is, now that we're opening up this window for you to see and pay attention to the signs of the issues that are going to be all around you in terms of mental wellness and prevention, in terms of sexual violence, in terms of substance use disorder, in terms of domestic violence. Am I missing one? Was it all four? It was all four. So that's my challenge to you, is that my hope is that we've opened a door for you today that's going to help you starting to think differently about the world around you, and then giving you some access and some connection to help others as they're struggling. So that's my challenge to you this afternoon. And now I'll turn the microphone back over to Dr. Provines. It says right here, Dr. Provines. And then you say, thank you, Dr. Hall. Your support of this initiative has been truly transformational. I am encouraged by all of this.
I'm very proud of you for saying that. Takes a lot of courage and a lot of vulnerability. And that's what we need in our leadership. We need you to be visible, vocal, and vulnerable about this. And so thank you for saying that. Okay, I know we've had a lot of talking, so I thought we'd have a wellness card in here. Hopefully many of you have a set of these wellness in the workplace cards. If you don't, we have some for you at the back of the room. But these are activities that you can do with your teams to infuse a little wellness into your daily life, into your work. And I specifically read the card to show you that you don't need someone with a mental health background like me to do something like this. So let's just get comfortable. Do a little belly breathing. So belly breathing is easy to do and can be relaxing. I invite you to close your eyes if you're comfortable with that, or find a focal point in front of you. And you can try this basic exercise anytime you need to relax or relieve some stress. So put one hand on your belly just below your ribs and the other on your chest. Take a deep breath in through your nose and let your belly push your hand out. Your chest should move very little. Breathe out through pursed lips as if you were whistling. Feel the hand on your belly go in and use it to push all the air out. Repeat this breath 3 to 4 times before returning your breathing to its normal pace. Now go ahead and just notice how you feel, and turn to your neighbor and share what you noticed. Okay. I imagine for some of you that was a nice, relaxing moment. But for probably another 25% to a third of you, that was stressful, because we're not used to stillness and we're not used to quiet. Oftentimes we're filling our time so much with distractions or work that we don't take time to just sit and be in the present moment. But I want to encourage you to keep trying and to keep practicing. This is a skill that can be developed
It's kind of like exercise. You don't work that bicep once and say, I've got that covered for the rest of my life. You really have to do it on a regular daily basis to get good at it, and then to be able to take those moments throughout your day before a really challenging meeting or after a difficult conversation, to just take a few moments and do a little breathing. It's a great way to connect to the presence and find that stillness within. So I hope that you keep trying it. Don't give up. So now we're going to move on in the program, and I would love, for you to hear some of the evaluation and the research that has been going on behind some of these programs that we've developed. And like Marcy was saying, it truly does take a village, and we have so many people helping. And I am very grateful to my colleague and dear friend, Suzanne Hawley, who has worked with us to evaluate the training as well as the wellness cards. And she's going to come up here and share a little bit of that research with us.
Thank you. It's an honor to work with such a wonderful, passionate people. I think it just uplifts my whole professional experience. So I want to say, I know we don't have a lot of time in our busy schedules, but time spent here is as time well spent. And I would say, as a professor in public health, that I really tried to bring home the message that mental health has been an epidemic for decades. And with the pandemic, we now call mental health the second pandemic. So this is something that was already existing as an issue, and now it will continue to be so. So I think it's a social justice responsibility for us to care for ourselves and each other. So I had the privilege to look at some of, there's thousands of people who have taken, individuals who have taken this training. And so I wanted to look at, well, what is the data that I could analyze statistically? And so we were able to look at pre-post tests because they're just going everywhere. And so all of the data is not represented in these analysis, but we have a larger sample now. But one of the things we wanted to know was, are people able to learn and gain knowledge in terms of knowing the facts surrounding suicide? Do they know the signs and symptoms? Are they aware of resources? If someone is struggling with thoughts and feelings of suicide, do they know about resources they can connect them with? How willing are you to intervene? And if someone is struggling, I think I would do something to try to help. And we found that this was significantly increased in participants across this 90-minute online training or live training. And then we also had university students, university faculty and staff, healthcare providers, Ascension Via Christi is a strong supporter. High school students, there was an entire high school that received this training along with all high school staff in our community, as well as just general community members. And so we did a repeated measures, ANOVA, to see if that increased. We also compared against all of these subgroups, including high school students, because we wanted to know that that was improved, and they were all statistically significant. We also looked at training modality, live versus online. They were not significantly different, but they were improved. Another thing we looked at was people who were previously trained. So some people have maybe done suicide trainings 4, 5, 6 times because that might be related to their work. And what we did find is if you did take 3 or 4 to 9 trainings, you did improve your learning and understanding less than someone who has never taken it. We weren't surprised about that. However, those individuals still significantly increased in their learning. So, it's kind of like this knowledge is good to think about and be reinforced with. So we want to provide empirical data to really support the validity of this and also promote that as well. Which study is, okay, wellness study. So one thing I did at the beginning of COVID was I learned about the wellness cards and I put them in a discussion board. So what I did was I teach 100% online, and I teach a leadership course, which is a general education upper division course. It's also a core course required for our majors in health professions for health management and health science. And so it's also a course that's required for the RN to BSN course. We have the dental hygiene online completion course. I get a lot of engineering students, lots of people. So I decided I would just introduce this as an optional discussion board, and I have 1,000 points in my class. So I thought if they do get 1 point of extra credit for doing a weekly discussion, then I can do that. That is the work I want them to do. And the thing is I will say that my leadership course really values in terms of its content, self-development, self-awareness, self-analysis, self-care, all kinds of things related to that. So the nice thing is that faculty can choose how these wellness cards or these questions can relate to your course. I would say anybody in a management, leadership courses, business courses. I also teach a course for the fine arts leadership degree. And so I just offered it to them to see what they did. So it was an experiment. And then I noticed that the students really loved it, but people would just kind of do it here and there. So then I decided the next semester, if you do it 8 times, 8 weeks in a row, then I'm going to give you your first extra credit point. Sounds like I have kids at home. I still do have kids at home. So then they did it 8 times, and then they got credit. And then I upped the ante more, which is it's just a tab in Blackboard. And then I said, I shared it more. I pushed it out more in announcements, and I emphasized they can get a free T-shirt. And so then, so we got more and more trickling in each semester. And then what do I want to tell you? We asked a lot of questions. So the sample is very small because later on, just in the last couple of semesters, it's like, oh, we should be evaluating this. And I love data, so we started evaluating it. It's a very small pilot study, but we can see in terms of belongingness, feeling important and valued, and that I have a sense that I can have developed a lot as a person over time. I'm trying to make big changes in my life. I feel like I belong to the WSU community. I am involved with the WSU community. I have made good friends. So these all increased over the course of the semester. And so I think what we need to do is we need to look at how other factors may contribute as a mediating variable to this. So I do understand there are limitations to this, but we at least wanted to test this out. And so the thing I have more information about is that we have agreement level. So the overwhelming majority said that they were satisfied. They used ideas in the wellness board. It helped them in their work and their life, and it was overall positive. So then I realized I did have more information in terms of the qualitative data, and I just asked them at the end as a wrap-up. I picked 15 of the questions that seemed to be more appropriate for online versus live. And I asked them, what they thought about it and areas of improvement. And the thing that was overwhelming were the themes that came out repeatedly. There were 71 students over the course of a few years, so 6 semesters. They really felt like that discussion board was almost like a safe haven of connecting because they were able to share things related to the questions And I think the thing that was really meaningful was they felt less feelings of isolation, and they were able to learn practical skills that they didn't think they had before. They were able to take a great break from routine, and they said, several times they said, this extra credit is the most relevant extra credit I've ever done in my life as a college student. It actually relates to being a leader. And so they thought that was really kind of refreshing. They said, sometimes we get, and so I don't know, I'll do anything for extra credit. So I didn't think it mattered, but they really liked it. So I'm going to have them speak, just a few students, and I think they can say it better than I can. One student said, I have never seen an activity like this in any of my previous classes, so I believe this changed my perspective on college overall. It can be difficult to build connections, especially in an online class, but the weekly wellness group helped me tremendously. Another student said, they allowed me to talk about things I wouldn't normally talk about. It's easier for me to hide behind a computer and pour my heart out than it is for me to do this in person. And when we think about the needs of our student population and how that will change with Gen Y, Z, Alpha, this is going to become even more important. And let's do a shout out for all the introverts out there too. There's lots of ways to connect with people, and you can do it deeply online. People get married from meeting online. So we know that this is not necessarily an inferior way to bond. Another student said, I felt as an adult learner, another important group, I was constantly failing, not smart enough, not intuitive enough, but I quickly found that everybody else had the same fears. Another student, I feel more equipped to handle difficult situations and take care of my well-being moving forward. I have never done this class before, and it made me feel like the instructor really does care about our well-being. So I had multiple students. I just never read them all until in depth in a one big data set. And I left them out because I didn't want to be self-absorbed. But they just, thank you, Dr. Hawley. You care so much about, and I'm like, I just gave you an assignment. I do care about you, but I can't believe I worked so hard in my class and I give you this. And you're like, you actually made us do this for extra credit, which means, it does matter because they were transformed. That was their experience. It wasn't me. So this could be you too. And then, so here we go. I would have never considered looking at this if there was no extra credit offer. But after being involved, it wouldn't have mattered. And so this is a thing, this is a self-discovery thing. Once you open up and then you feel, oh my gosh, everybody else has problems too, and they're stressed out and, they connect with each other. So that happens over time. That's why I changed it to, if you're in this group, you're in this group. So try to hang on. The concept of self-care was not new to me when I started, but it played an important part of me completing the semester. There have been a lot of changes at work on top of being a full-time graduate student, and self-care has been a critical part of my success this semester. I really learned all about the different ways I can fuel my well-being and overall be a better leader. Additionally, I was able to learn more about my classmates although we all live around the globe. And lastly, I think these activities couldn't have come at a better time with what's going on in the world, my personal life changes, and what are happening to me right now. So this is just a sample. And, one of the limitations I would say to keep in mind with this really has been a wonderful student opportunity. Some students say this should be in every single class. And I said, whoa, so class 1, what are the 5 senses? Class 2, what are the 5 senses? Class 3, what are the 5? So really, one thing we did do is, for those of you who don't know, I created an open Blackboard shell on Ultra and Blackboard Learn with all the questions. So anybody can have that. All you have to do is email me or somebody else, and I just make you an instructor. So you can import that into your Blackboard shell right now. However, you want to think about it, how you want to use it. how you might want to roll it out. It could be, a lot of students say this is all new to them, but certainly, if every class is doing it, that would be some repetitiveness, but this is still wide open. You guys are early adopters, pioneers if you're doing this, so the sky's the limit in terms of what you want to do. But I think that it is a great opportunity for students, and they like it, and they're saying thank you for allowing this to happen. So that's it.
Thank you. And can you stay up here? Isn't she amazing? She is just amazing. And she is our first faculty fellow ever. And my gosh, she has earned that distinction. And we wanted to surprise her today with our first Campus Wellness Champion Award for all of the work that she has done to help us evaluate these interventions and what you've done to disseminate the research, and you present on it, and you've gotten this training on other platforms in other states. And so just truly, you are an amazing friend and you are a great colleague. And I could not think of someone else more deserving of this first award. You like me. You really, really like me. No. We come over here. Okay. I would also like to welcome our next group of wellness champions, and this is Jen Ven's class and her students. So you did not all know that you were getting an award today as well, but we have an award for you also before we get to hear about the wonderful work that you did in your class this summer. Come on up, come on up. You too, Jen. So I'm so excited for you to hear about the work of Jen and her students. They will be sharing that with you briefly. They were not aware that they were going to be getting an award today. But let's get another picture with our group of students and their fearless leader, Jen. All right. I first met Jenny at one of our community trainings that we had done at City Arts. And there weren't very many people that were able to come that night, but I'm so glad that Jenny was there and we connected. And then it just continued to evolve and to blossom and to, her class worked on helping us with our Hope Kits this past summer. And so we're going to hear from them on what their experience was like and more about that project. Yeah, it was a surprise. They're the first class to really collaborate with the wellness areas on these initiatives. And I'm glad to say that we're partnering with a group of marketing students out of the Barton College of Business here, and that we're also working with some students in the College of Engineering to help with our tech needs. So we're just using all kinds of student help and applied learning assistance to really help this be a campus initiative that is better because our students are helping with it. So here you go.
Thank you.
All right. So thank you. That was incredible. We had no idea. So I'm flustered because I didn't know. Thank you guys so much. So I'm Jenny Vin. I'm a Wichita native, and I grew up on Wichita's neglected South Side. And I'm also a first-generation college graduate. I had the great privilege of studying graphic design at Fort Hays State. So after undergrad and graduate school there, I started a career in academia. And all of my research over the last 15 years has been in design for social change. So I've had one foot in academia and one foot in my business, Studio Genvin. So I design for clients and small businesses, nonprofits, all rooted in something to do with social change, making the world a better place. So after doing a residency at the School of Visual Arts in 2013, and that was specifically a design for social change residency, which was incredible, I ended up boomeranging back to Wichita unexpectedly in the most divine form of intervention, I shall say. And ever since then, it has been my dream to have a course to pay forward all of the amazing things that I was taught. So this summer, teaching this course was an incredibly full circle moment for me. So in 2023, I inadvertently met Dr. Provines and was introduced to Suspenders for Hope. I had no idea of that before. And that's the first time I saw the Hope Kit. And when I saw the Hope Kit, and let me back up and say, like, my family of origin always taught me to be a helper. My design professors taught me that designers have great power, incredible power. And we can use that power to sell stocks, or we can use that power to change the world. And so they challenged us to make a decision upon leaving that program. So I chose the latter. So when I saw the Hope Kit, I saw some ways that this most meaningful thing could also be enhanced by walking it through the design process. So I reached out to Jeff Pulowski at ADCI and said, hey, I have an idea for a course. Hear me out. And he said, yeah. And then I contacted Dr. Provines and I said, listen, I have this idea. Can we? And she said, yes. And then also bless Jeff taking it to the university because they were able to make this an accessible course over the summer. So a lot of students were able to attend that wouldn't otherwise have been able to through the support of the university. So it really took so many people coming together to make this dream a reality. So the Hope Kit started out, right, as this form that you see here. And then during the 8 weeks that we spent together, we truly walked it through the design process and specifically the design for social change process. So I'm deeply interested in the end user and deep data dives, deep research. We did a focus group. Shout out to our focus group member here today who gave us incredible insight on mental health in the military community. And also, too, sustainability. I'm so happy to hear that because one of the things we evaluated were how many of these items are going to almost immediately directly end up in the waste stream and what can we as designers do to intervene in that. So by the end of the 8 weeks, we had completely transformed the Hope Kit into an even more meaningful and heartfelt tool. Rather than a large box that could be cumbersome to leave a facility with, it's now in a tote that is very discreet. Also comes with a revised letter, really working on marketing and copywriting techniques, and an adult achievement sticker set rather than just a lapel pin. And then also instructions on how to use a gun lock. The majority of our class actually did not know that it was a gun lock. There were a lot of, the bike lock? Why is a bike lock coming with the kit? So instructions on how to use that. Also, too, we engaged with an illustrator in the class to re-illustrate the coloring sheets. So now they're custom coloring sheets designed by a local artist rather than just random ones found on the internet. And the most meaningful piece was that we brought everything together from the original Hope Kit and put it together in the Hope Kit handbook. So that is now a handbook that becomes a companion piece for someone in their journey to wellness. It's a 30-day guided journal. There's prompts in there. And there's also connections to NAMI resources, connections to the Suspenders for Hope videos,
And that's also in paperback so that it can be used in a psychiatric facility. Hardbacks are not allowed. Same thing in an emergency facility. Hardbacks are not allowed. So this is a paperback edition. I could keep talking on that forever, but I do have the most amazing Lindsay Stang. This class was really geared towards helping the students have a professional learning experience, an applied learning experience, and to learn how to wield their power as graphic designers to change the world. So I want to let Lindsay talk a little bit about her impact and thoughts on that.
Okay, let's see if I can get through this without crying. Ladies and gentlemen, my name is Lindsay Stang. I'm a graphic design student. Today, I stand before you with immense gratitude in my heart. I want to begin by expressing my sincere thanks to Suspenders for Hope for entrusting us with this remarkable opportunity, for believing in our ability to bring their vision to life. Working on this project has been an incredible journey, one that not only honed our skills as designers, but also taught us the importance of collaborating and working together to understand the client's brand. It's been a privilege to work within the framework of Suspenders for Hope's mission, a mission that resonates deeply within us all. The Hope Kit, the heart of this project, is more than just a collection of graphic elements. It is a tool, a lifeline for an individual striving to prevent a second suicide attempt. It carries a powerful message. You are not alone in this journey, and it is okay to speak out when you need help. This message of hope and solidarity is something we should all carry with us all. I must take a moment to express our heartfelt gratitude to Jenny, whose guidance and expertise have been invaluable throughout this creative process. Jenny, your mentorship has been a guiding light for us, and we thank you for walking us through every step. To Suspenders for Hope, I want to say thank you for being the voice of those who may not feel that they can speak up or are afraid to do so. Your organization's dedication to helping others is truly inspiring. The impact of this project will reach far and wide, touching the lives of many loved ones, and that is an incredible, powerful achievement. In conclusion, I want to reiterate my deepest appreciation for this opportunity, for the meaningful work we have been able to accomplish together. Let us continue to be the bearers of hope, advocates for those in need, and champions of the message that no one is alone in their struggles. Thank you once again, Suspenders for Hope, for this chance to make a difference.
I'm not done. My students know she's not done. She's not done. I have one small thing. So, in the end, this summer was not only use design to enhance a life-changing and life-saving kit, but it also changed the lives of the students in the course, and it also saved lives of students in the course. Every student who took this is now trained in suicide prevention. They're also mental health advocates, and most importantly, now they know how to advocate for their own mental health. Because of, here we go. They also know I'm a crier, so because of this work, one student in this class knew exactly what to do and where to go in the moment of crisis earlier this semester. So it worked. This is why we do the work we do, and this is why we're here today. So I would like to leave everyone in the room with this. All of you, everyone sitting here, has significant power, which means you also have significant responsibility. So how can you each individually wield it in the name of wellness? And also, how can we collaborate on that together? That's all. I'm really done with that. Thank you.
Meeting these individuals and everyone in the class was such a gift. It truly was a highlight of my life to go and hear the students give their presentation. Not only was the work excellent
and invaluable, and something we would have paid thousands and thousands of dollars to have a firm do the level of work that these students did. But it was transformational for me personally, because I am that grandkid of independent Kansas farmers who can do it all on their own, and self-reliance, and it's hard to ask for help. And man, I was like, yeah, we need Hope Kids. And it's like, you can help make them better. And so thank you for teaching me, my own lesson is that sometimes we have to let go, and sometimes we have to surrender and get help from others to make it better. So it was just really, truly a treasure. And I'm so glad that many of you are here today. And it does speak to the power of advocates. And when you go through one of our trainings, that we all have a role to play, and that we all can lead in this area, and it just keeps expanding. It just keeps expanding, and I love that. So, we are going to let's see, little break or keep going. Yeah, let's do a little break. We're going to come back at 2:35, and then we will move into the training.
For those of you who are still here, thank you. I know this is a long event, and there were many people who said that they were going to have to come late or leave early. So thank you for still being here, and we're going to kind of go through this information fairly quickly so we can get you out of here on time. Yep. Let's see what's happening. There we go. But I shared with you my journey at Wichita State 25 years ago, and how I was depressed as that sophomore transfer student here. But I wanted to share a little bit more about my story with you. I'm a mom to 3 beautiful daughters. There is my high school sweetheart who broke up with me that sophomore year. So, sometimes you need to go through challenges to make things stronger. And that is a life lesson, and it helped our relationship too. But in my journey to becoming a psychologist and to working with students on their mental health, sadly, I have lost students who have come to me for help to suicide. It was in 2015 when we got the Garrett Lee Smith Campus Suicide Prevention Grant, and that very same month, I lost a student who I had been working with to suicide. And like many loss survivors, I know I'm not the only one in the room who's experienced that kind of loss. It will impact all of us at some point in our life, either very directly or indirectly. I poured a lot of that grief and a lot of that emotional energy into, becoming an expert in mental wellness promotion and suicide prevention. And then sadly, it was just over a year ago that I lost my 3rd student, and I thought, I don't know that I can keep doing this work. Then I was like, you fraud, what do you think you know about this, and can you really help? And those are difficult times. But I do think it is through some of that pain and some of that suffering that we can then find a way to transform it into positive impact. And so I'm over the moon that we are here today, and I got through some of that. I've done a lot of healing, and I'm just more motivated to try and bring that message of hope to people in times of despair. So I appreciate you all being willing to join on that mission and to help us, because as you can see, this is not done by our little team alone. This is really a community effort, and I am so grateful. So how are you doing? really, how are you doing? Here's a list of things that probably involved in a lot of your jobs. And the list just goes on and on and on. And I don't know about you, but if I look at my productivity and I think that that is what I'm worth, then I can't even get through my inbox in a day. And so we have to change that idea that our value or our worth is tied to our productivity. So there's a lot that you're being asked to do, support the mental health of students, focus on these new projects or these new initiatives, and, do your curriculum and, get grants, do research, all of that. And it leads to a lot of feeling overwhelmed, stressed, low. Yesterday was World Mental Health Day. What did you do, to feed your own well-being? What did you do? I'm glad you're here today. Let's do another card. And I was going to do mindful breathing, but I think I'm going to change the card up, and we're going to focus on, why don't you turn to a neighbor? Hopefully you're still sitting close to someone. And share with your neighbor 2 to 3 positive things that happened to you in the last week or so. And your job is to keep one another on a positive track, redirecting negative thoughts to something positive that happened in the last week. Yeah. No, okay. This is really what it's all about. It's truly taking time to connect with one another on a personal level. I think when we create space in our workday to do that, to connect with one another on a personal level, we feel like we're so much more supported by our coworkers and by the environment. So I hope that you take some time, but I know, man, today getting all this stuff together, writing scripts, that is not in my wheelhouse. I don't write scripts. But I was really stressed, and this morning I was like, man, come on, this is a wonderful day. I'm going to get to share this message with my campus and, with my community. And so how can we sometimes flip that viewpoint to the positive? I know part of how I, nurture my mental well-being is I try and take time every day to do some reflection and to really engage in gratitude and think about what all do I have to be grateful for. And if we can stop and do that, I think you'll notice that things will start to change and your perspective will start to change. So, mental health. Perfect timing. That was perfect timing. So we all are susceptible to a common cold, right? Same is true for our mental health. We don't always seek, healthcare providers' help when we're having symptoms of a common cold. But there may be times when that turns into something more, and getting help would be a good idea. But even when that's the case, we know that this has turned into something more severe. We've been sneezing and coughing at work, and everyone's been like, have you gotten that checked out? And you've been coughing for like 3 weeks now, or have you talked to a doctor? We still don't always get help. And what stands in our way from going to a doctor if our cold has turned into something severe? What stands in your way? Too busy, can't afford the time off, stubborn. Yeah, there's all those barriers that get in our way, and particularly when we start to think about our social determinants of health. Do we have paid leave? Do we have health insurance? And if we have health insurance, what kind of coverage do we have? Do we have access to culturally appropriate care in the area in which we live? Or are we isolated in a rural community with few access to healthcare resources. All of those things, play a role. But when we're talking about our mental health, the same is true. We are all susceptible with challenges in our lives from various points with our mental health. And we don't always, seek help for that. We might talk with a friend, we may go on a walk, but if it's starting to be more severe, and we need to reach out for help, oftentimes there's additional barriers with mental health. And what is that? The stigma. It's the stigma around that. And that's really what this program is about. It's how do we end the silence? How do we end the stigma? And to know that we all experience challenges with our mental health from time to time, and that it's a triumph to be celebrated if you have overcome that challenge, and not a shameful secret to be hidden. But when you're depressed, what do you want to do? Sleep. Nothing. It's hard to get up in the day and manage your own personal hygiene, let alone navigate a complicated mental health care system that is overwhelmed with an overwhelmed population. So this is when we need each other the most. But because of stigma, we think, oh, it's personal. I don't want to say something. I'll just make it worse. We tend to shy away. But really what we need to do is lean into those moments, because it's when we need each other the most. So just think, what are some of the things that you've been experiencing in your role here? This is not a multiple, choose one kind of answer. These are just up here to kind of give you some ideas of things that you may be seeing in the work that you do. Normally I would have you break out and talk, but we don't have that time. What I imagine is that you've all seen some level of it. And what I like to point out is that when we're addressing A, B, and C, that is preventing things like D, E, and F. And so it really is connected. And I'll talk to employers, well, come do a mental wellness training with us. I don't know that we want to do suicide prevention, but we can talk about mental health. I'm like, oh, that's stigma. But it's all related. It's all related. If we can be addressing stress and burnout, then hopefully we can have upstream approaches that are leading to prevention of some of our most serious outcomes. And it's important that we address this in the workplace, not because it's the moral imperative and it's the right thing to do. It is, but it's also good for business. Our students will do better. We will have better outcomes. We will all thrive if our people are thriving. So just reflect on how you think you're doing in your area. How do you think your workplace is doing, your department? How are they doing at addressing mental health in the workplace? One of the things the research tells us is when you ask leaders of an organization and the frontline workers the same question, they have very different answers. So sometimes all of those programs are not trickling down, to the people that need the resources the most. And so we all can do better. The National Action Alliance for Suicide Prevention put this framework together. This is a national framework on what organizations should do if they want to promote mental wellness and reduce suicide in the workplace. And as you can see, it's very involved and very comprehensive. What I want to point out is that it has to be comprehensive and fully integrated into the fiber of everything that you do. And it absolutely has to start with the leadership. Why I am so encouraged today that we had so many of our leaders here talking about the importance of this and willing to help us enhance what we're already doing. So we took that framework and we simplified it into a 4-part approach. And so we like to say that this program is more than a training, that it is a strategic, comprehensive approach to help organizations address their mental wellness culture, reducing stigma, strengthening connections, improving emotional well-being of its people, and encouraging everyone to get help when you need it. So that 4-part approach does include the Suspenders for Hope awareness campaign. It also includes a training. And so you can take the training. Some of you have probably taken our 90-minute training online, or you've participated in one of our in-person workshops. I highly encourage you to do that. And like, Dr. Holly shared with us earlier today, even if you've already done training, sometimes redoing it is not a bad idea. And then there is the wellness curriculum and the advocacy program. So when we were creating this campaign, we were trying to think of, this can't be a program where the mental health department on campus is supporting the mental health of our community. We have an overwhelmed population with an overwhelmed system, and addressing the mental health issues of our society cannot be on the shoulders of our mental health care professionals. It absolutely is going to take all of us. It can't even be the leadership supporting the mental health of campus. It has to be each and every one of us. So this is a campaign that empowers our community to support each other in their mental wellness. And to have you think about, what is it that you can do to support your own well-being and the well-being of your coworkers. So you've hopefully seen these all over campus. This is what we want you to do. Be visible, vocal, vulnerable, talk about mental health, check in when people are struggling, but also it's just as important to ask for help when you need it. We worked with the marketing department and found out that students who were familiar with this campaign and what it stood for were much more likely to say that the university cared about them as a person and their mental health. And after our first 3 years, when we had the first suicide prevention grant, we had brought in a lot of national trainings. And unfortunately, we just didn't get a whole lot of engagement on campus. I kind of felt like we were trained in the choir. A lot of our social work faculty would show up, students, psychology, but we weren't reaching everyone. And so we thought, well, we can make it shorter, we can change it, and we can really try and inoculate our population and get this training to everybody. We saw immediately a 426% increase in the number of people we trained in that first year alone. And now we've trained over 6,000 people in our community in this, and it just continues to grow exponentially. The cards are that idea of, how can we sneak the spinach in the smoothie? How can we get the engineering professor to talk to their students about their mental wellness? But most importantly, how do we center that in group activities where we're fostering connection between one another? And we're opening up with some time for shared vulnerability, where we're truly getting to know those that we interact with on a daily basis, on a more personal level, so we can be there for each other through the hardest times in our life. So just by a show of hands, what do you think of the 12 million Americans in this country who report having serious suicidal thoughts? What percentage do you think die by suicide? A, 10%, B, 5%, C, 1%, or D, less than 1%? A lot of you chose not to answer. You're just like, I don't know. I don't want to be wrong. That's okay. While one life lost to suicide is one too many, overwhelmingly, the majority of individuals who go through a suicidal crisis find a way to get out of that. And that is where prevention comes in. And that's why it's so important that we share our stories of recovery, of resiliency, so we can let people know that they're not alone. And we don't suffer alone thinking this is just me, because it's more common than what anyone realizes. And it is a triumph to be celebrated and not a shameful secret to be hidden. We're going to watch her video and then wrap up pretty quickly.
Let's pray. This is actually my second time getting sober. I started using substances when I was about 14, so about the same time I had my first depression diagnosis. Most of my life, I have struggled with mental health problems, depression, anxiety, ADHD. Throughout those years, and sometimes still today, I've experienced very dark periods of time in my life. The classical depression symptoms, the low self-worth, the feeling of helplessness and despair, thinking I don't have anything to offer the world, thinking there's something wrong with me. I've definitely struggled with those feelings a lot, to the point of being suicidal. I fortunately never attempted to take my life. I always was able to either find some resources or have the support that I needed to get through those dark times. Throughout my years struggling with depression and with those symptoms, I also developed an addiction to alcohol and would use other substances as well. I have just over 3 years sober now, and that's helped me tremendously with my mental health. I would just use alcohol as a means of escaping and avoiding my feelings, avoiding responsibilities. I was a functioning alcoholic. I was able to hold down a job, had a family, owned a home, and earned a couple different graduate degrees. So I was able to do those things. I knew that I had a problem the whole time. It was just that I didn't quite know how to quit and wasn't ready to commit to quitting. I was working on my doctorate, and it was a couple years into the program. I had a beautiful baby girl. Actually, I had her my first year of the program. I was surprised. She was 4 or 5 when I sobered up. And, you know, I was a high-functioning alcoholic. I didn't abuse her, but one thing that I did do, which I'm ashamed to say, was I would drive under the influence of alcohol. You know, in my head, I told myself, like, oh, I'm in control here. I'm not that drunk. I'm not whatever. But I knew that, you know, I'm taking a risk with my daughter, whether getting into legal trouble and having her taken from me, or God forbid, hurting her in an accident or somebody else. I think just realizing that how much of a better mom I could be for my daughter, just really seeing her and seeing how much I was letting her down. I just didn't spend that quality time with her where I should. I was able to just kind of decide to quit. I was going to therapy. I attended hot yoga faithfully, and it was a very, very hard class that made me want to die while I was in there. But it really helped me get the early year, like the first year of sobriety. I had family support, just my medications that I used for my depression. I think the hardest part of it for me was just breaking the ties with people that I would use for the drinking with. Some of the ways that I've learned to cope with the depression, first, just taking care of my basic needs, so making sure that I get 8 hours of sleep and prioritizing that and not feeling selfish about that, making sure that I schedule playtime into my day and time to get out into the sun. Physical activity has been a huge staple for me. And then adding like the social community aspect, which is why having this job here at Phoenix has been so great for me, because we do both. You know, it's physical activity, it's positive support. I do therapy regularly, and I have medical treatments that I use. For me, it was about finding a doctor that I trusted and who was willing to work with me and try all the different things and kind of just figure out what works for me, things that help me stay sober. This job, just being in a position where I'm surrounded by other people who are in recovery, so being connected to those people that are experiencing similar things or have, similar experiences, has really helped the message that I have. And one reason that I am truly thankful that I've experienced what I have with mental illness as well as with substance abuse and addiction, because now I'm able to help other people. So being able to share my story and offer a message of hope is so important to me. I believe that talking about our issues is the only way we're going to break down stigma associated with mental illness, especially, well, and addiction, because they're very common things, and it's not a choice. People don't choose to be depressed or choose to be addicts. So I think I just want to spread that message of hope and let people know that, like, no matter how bad it is or how dark it seems, keep fighting, find what works for you, try different things. If you get with a therapist and that isn't a good fit for you, find another one. If you get a diagnosis that you feel like, doesn't hit you right, get a second opinion, like, keep trying, keep fighting. You will find what, your combination, your cocktail, all of that's appropriate to use. But hang in there, don't give up. It will get better.
Isn't that amazing? She's so courageous and brave. I love that she shares. Oh, let's hear. So what, when you go through our training, what we encourage you all to do is try to help is to learn this method. It's the share, ask, support method. And that is just to share your concern and simply let someone else share. Listening to understand and not, having to respond or fix anything. And if you hear warning signs of suicide, which we cover in our training, we encourage you to ask directly. Asking about suicide directly, this, signals to the person who grew up with the same stigmas that we all did, that it's okay to open up and talk to you about it. Oh, well, I can talk to you about this. And if they say no, that's okay. And then offer support. And that's first by being human. It's not just here's the EAP plan. It's listening, being present with someone as they're struggling, accompanying one another in our pain, and then referring to resources, but making sure that you also follow back up. So share, ask, support is the method. Remember to take care of your own mental health. That share, ask, support is just as applicable to us. If you are struggling, share that with someone. Talk about it. Ask for help when you need it. And reach out for the support that you need. A good place to start is your physical well-being. What is good for the body is good for the mind. And so if you're trying to figure out, how do I start? Where do I start here? Just think about, some of these basic self-care activities that might be increasing your sleep. Maybe I don't need to get up earlier this morning and read more email. Maybe I should sleep in. And then, how can you validate those emotions, that you have, and find a way to express them? Here are some of the resources. There's an employee assistance plan. You can call your health benefits plan. If you want information about community referrals, the counselors at CAPS can help you find local counselors. There's the 988 crisis line, and there's other hotlines there as well. The Trevor Project for individuals that are LGBTQ to know that they will be affirmed by who they're talking to on the other end of that call. ComCare Crisis is a wonderful resource, and we partner very closely with ComCare Crisis with our students. It's just located a few miles from campus. Going to the local emergency room if it's a safety emergency, and knowing that Ascension Via Christi and Prairie View and Newton are our two local psychiatric inpatient facilities. We already talked about the Hope Kit. This idea came when my daughter was diagnosed with type 1 diabetes, and we got all kinds of stuff in the hospital to start our journey. She came home with 3 different teddy bears, and I had different, books and stuff, and calorie counters, measuring cups to start our journey. And I thought, why do people who go to the emergency room for a psychiatric emergency not get the same kind of love and care? And so this is an evidence-based intervention to help you, because what we know about individuals who've survived attempts is that 50% of them didn't didn't decide to act on that thought until 10 minutes right before. So consequently, many attempts are very impulsive and a reaction to intense pain, and they're not a well thought out logical thing. And so a HOPE kit from dialectical behavior therapy, the first evidence-based treatment, is a way to pool all your coping skills into one place. So your distressed mind doesn't have to figure out what to do. Because oftentimes it's a mistake made by a mind under siege that believed the distortions that their loved ones would be better off without them. We know, those of us left behind, that is not true. So we would love to get HOPE kits to every patient and get this message to them. And you can build your own HOPE kit. Put things in there that distract you, that comfort you, that help connect you to your reasons for living, that encourage you to, be mindful with the present moment, to reach out for help and to safeguard your surroundings by, locking up firearms, having things like naloxone in your first aid kits at home. What kinds of things can you do to make your environment safer? Now, we'd love for you all to be advocates. And so you have sheets on your tables there of how you can be an advocate. And that is what I'm going to leave you with. We're going to, take some time to connect. The cookies are gone. We tried to save them afterwards so we could all connect and have cookies, but it didn't work out. And so we've got just a little bit more time, to stay here, connect, and share. What can I do? How can I be visible, vocal, and vulnerable? How can I not only check in with people when they're struggling, but ask for help? How can you help us share this message? Follow us on social media, share the messages, wear your shirts, take the training, give us a gift. $60 helps us, give a kit to someone in crisis. You can do all of that at suspendersforhope.com. And if you want to take it to the next level and become a certified Suspenders for Hope facilitator, this is where you can sign up to do that. So I will leave you all, and I'll be hanging around if you have questions. But I will leave you all with this. What can you do to be an advocate? What can you take back that you've learned today to your area and help advance this and help the mission of bringing hope to people in times of despair?